The honourable member for Lac-La-Biche St. Paul, Two Hills, followed by St. Albert.
Thank you, Mr. Speaker. Yesterday, the Premier accused the opposition of fear-mongering for identifying the reckless and dangerous decision of relocating Medivac services. But in a letter signed by now over 65 doctors in the north, with over 20 alone just in Grand Prairie, they state the government's relocation plan is flawed and conclude, I quote, "Moving the Medivacs on March 15th is unnecessary, costly, and will have fatal consequences." To the Minister of Infrastructure, with no expected building of a tertiary hospital in the north anytime soon, are you going to negligently ignore the warnings of the 20 doctors in your area?
Hear, hear.
Thank you, Mr. Speaker. Mr. Speaker, I've consulted with my constituents and these doctors I've met with, and it's not infrastructure's job to build hospitals. We build them, but in consultation with my colleagues. And we are building hospitals in the north, Mr. Speaker. We're building 3 hospitals at this present time that will add, including one in Grand Prairie, Mr. Speaker, that's going to help replace the services that we're doing.
Thank you, Mr. Speaker. Given that these 65 northern doctors have stated, and I quote, "For critically ill and injured people of the north, the extra transport time will result in needless death and disability." Wow. Minister, are you honestly asking northern Albertans to trust this government over the doctors? Really?
Here, here. Honourable Minister. Honourable Minister.
Well, Mr. Speaker, as I observed yesterday when similar questions were asked by the opposition, people's perception of the move of the Medivac facility is going to be a direct function of the quality and accuracy of the information that they're given. And we know, Mr. Speaker, that there have been several meetings in northern Alberta where inaccurate, misleading information has been presented about this change. Mr. Speaker, the fact of the matter is the government is not going to wait for the City of Edmonton to functionally close the airport. To do anything less would be irresponsible. We started our planning over a year and a half ago. We are delivering a state-of-the-art Medivac facility for the residents of northern Alberta, and 67 patients.
Honourable member.
Given that 4 Fort McMurray doctors have now signed the same letter and concluded that moving Medivac on March 15th is unnecessary, costly, and will have fatal consequences, will the Minister of Accountability, Transparency and Transformation confirm that no northern doctor will be bullied, intimidated, or called fearmongers just for standing up for their patients and standing up for northern Albertans?
Mr. Speaker, it's arrogant and ignorant, quite frankly, of the opposition to ignore the requests of the City of Edmonton and their plan to go forward with the closing of the municipal airport, Mr. Speaker. Healthcare has worked very hard, Alberta Health Services, to make sure that Medivac services are not compromised and, in fact, enhanced in many cases, Mr. Speaker. And the building of 3 hospitals in northern Alberta means that we're moving services to Albertans, not simply expecting them to always Medivac in. We're building the north and building Alberta for the future of this province, not just for today.